我很高兴王应秋校长还有胡博士你们所有的参与的专家教授学术人的院士还有很多的专家教授院士都是推动这个中医在全球做了很多工作，所以我真是有机会利用这个平台来分享一点我们在 UCLA 这30年的经验，还是学习很多这个你们的专家的手法啊、经法啊，来去带进我们这个医疗系统里面。谢谢。
Thank you so much， 谢谢许家杰教授 Dr. Xu。那我们大家现在呢，是不是把视频开一下？我们合一个影，然后我们就进行学术的讲座，然后就播放许家杰教授的贺词，就进行学术了，好吗？请 everybody please turn on your video. We will take photo together, and then we will beginning to next step to do the our communicate with the medicine and the Chinese, the culture, the arts, everything. Okay, thank you. 好，谢谢每一位，请开一下视频。好，我来做一个截屏。1、2、3，请开一下视频。1、2、3，再开一下。哇，太多朋友了。给大家也说明一下，我们在这里会场的人并不多，但是呢，其实我们主要的人员是投射到几个频道在直播，有这个国内的奇幻网直播，大约有7、8万人现在已经同时在线。然后呢，还有我们 YouTube 的 channel 也在同步直播，也欢迎大家把链接分享出去。然后呢，我们这个 Webinar 只是主要给要拿学分继续教育的人缴了费的来参与进来的，所以人数并不多。还有就是主要的讲课的专家1个、2个，每一个都轮着来的。好，大家1、2、3看屏幕 ，Thank you。好，谢谢。好，下面 Jennifer 请播放许家杰教授的致辞，然后播放他的教学。Thank you, thank you so much, Dr. Zhu 。先播放短的，再播放长的哦。
我这边长的
啊，
你先播放。
那你先播放吧，没关系。
Thank you so much for the organizers to allow me to share my half-century academic journey at UCLA Health in the development of integrated medicine through the platform of UCLA. When I finished college at UCLA in chemistry, my initial idea at UCLA was to find a new drug from the herbal pharmacopoeia, just like Professor Toyoya, who got the Nobel Prize for discovery of artemisinin for malaria. But when I was studying neuroscience during my first year of medical school at UCLA, I saw acupuncture being used during surgery. And then subsequently, I found out that China already have embarked on integrating Chinese and Western medicine since 1955. So I used my spare time during medical school to gather as much information about Chinese medicine, about integrative East-West medicine, and try to understand the differences between modern biomedicine and traditional Chinese medicine. So I have learned from many of the pioneers since the 70s. So I specialized in internal medicine after medical school, and I subsequently subspecialized in clinical pharmacology and geriatrics, with the hope that this would allow me to use the non-pharmacological approach of Chinese medicine to help solve many of the problems that defy the very best of Western biomedicine, and also minimize the adverse drug reactions. I also was intrigued by the neurochemical basis of acupuncture for not just pain, but also many of the clinical applications. And I spent my first 20-some years teaching internal medicine and clinical pharmacology at UCLA until 1992, 93. My dream of putting the two together have urged me to launch the Center for East-West Medicine. Even though there was no money coming from my chairman and the health system. Now, in 1993, Chinese medicine, chiropractic, and many of the other approaches to healthcare that is unconventional have been labeled as quackery. But I've been lucky enough that my mentors, my chairman of medicine and also my dean who retired and have been very supportive of this dream of a young medical student. But I launched the center with very little support. In this photo PowerPoint, we celebrated the center's 25th year anniversary with the opening speech by the president and CEO of the UCLA Health System. Well, I started as a one-man band, and our goal is not to study one herb, one modality, whether it's Tai Chi or acupuncture or one disease. Our goal is to blend the two medicines to create a better healthcare model. And I started the clinical program first because I believe that in the place like UCLA, demonstrating the value of Chinese medicine, such as the health cultivation thinking, teaching people how to use acupoint for diagnosis and treatment, and also to try to have people eat right based on their pattern. We start very quickly in training our medical students. First year in 1995, and our fourth year medical students in 1996. We also have done different type of research, from mechanistic research to outcomes research to policy papers, working with the WHO. And we also collaborated with our international partners. Well, the reason why I said 50 years of my journey, back in the 70s, I already gathered many of the books and publications that I can get during the Cultural Revolution. I already read a lot about Chinese medicine, particularly some of the books written by my friend and my mentor, Master Deng Tietao, and his ideas of helping to prevent medicine, to help patients with myasthenia gravis, and also his approach to work with the spleen system. But most importantly, I think the world owe him what he did by bringing Chinese medicine in conquering SARS, so that the experts from Guangzhou and also Beijing and Tianjin, academician Zhang Boli, and also academician Tong Xiaolin and Professor Zhang Zhongde, because of the experience with SARS, they were able to forge into Wuhan, have the courage to use Chinese medicine to deal with an unknown disease, COVID-19. There is a lot more that we can learn from Master Deng. And I will not have enough time to talk about what I have learned from him. Besides the masters in Chinese medicine, I've learned from many of the integrators back in the 70s and 80s. I still remember getting a paper from academician Han Qiseng in the late 1970s about his work on the neurochemical basis of acupuncture, analgesia. And I read about Sun Ji and his work on TCM therapeutic approaches. And Chan Keqi Yuan's plastasis work, academician Wu Xianzhong's work on the acute abdomen. Obviously, I'm very intrigued by Professor Wang Boen's work on approach to infectious disease. I recently gave a tribute to Professor Xie Zhufan, who passed at age 98, about his work on translation of Chinese medicine. I've learned from Professor Yu Jing in Yi Sui's approach to women's health, and also Professor Li En in his approach to working with the kidney system. And obviously, I was reviewing many of the work with Toyoyo, and I interviewed her in China Academy of Chinese Medical Sciences and put her interview on YouTube in 2006 before she got the Lasker Award in 2011 and the Nobel Prize in 2015. I invited academician Chan Keqi to represent China in an international conference on what the world needs to think about how to approach botanicals, herbal medicine. And we have invited Master Chan Keqi again in 2006. And over the years, I have participated in many of his meetings, both in Beijing and also in Fuzhou. Obviously, I've learned a lot from academician Chan Kai-Xian, not just his thinking about herbal medicine, but also about his thinking about the role of Chinese medicine in global healthcare. Besides the first generation of the pioneers of integrated medicine, I also have worked with the second generation, Professor Wang Wenjian, who was the first doctoral student of academician San Qiyan, and also Professor Liu Luming in the Fudan Children's Hospital. I think that there's a lot that we can got out of Chinese herbal medicine in terms of active ingredients, but I believe that Chinese herbal medicine is much more than a vehicle to get active ingredients as a Western drug. And I believe that going through the FDA route for even a Chinese herbal formula may not be the best way. I believe that it will be best to try to develop a system of interprofessional setting where Western MDs who recognize the value of Chinese medicine would work with the acupuncturists who would work closely in an interprofessional setting where herbal medicine can be used safely and effectively. Obviously, UCLA has been blessed with the visits of the two commissioners from the state administration of TCM, and we have become a platform for training not just people within the West and the United States and UCLA, but also we have involved in the training of many of the experts from China. Now, obviously, we start out our work in the clinic setting because I know that you can do research, you can teach courses, but unless you demonstrate a model that incorporates Chinese medicine in solving problems, it would not be as impactful. So I started out with the clinic back in 1994. And now we have grown from a 1 to 2 room clinic sharing clinic rooms with heart transplant and kidney transplant to now 4 dedicated clinics and also an inpatient program. Our model blend the best of both models. And I think that by having the 2 models used concurrently, it allows us to have a more comprehensive vision of why someone is not well and in what way we can help them get better. Most importantly is to recognize the value of Chinese medicine's concept of balance and the ability for the body to heal itself if you do not give them a lot of stressors. And we personalized according to the pattern diagnosis. And most importantly is to try to understand the root of the problem. Oftentimes it's at the person level. If we do not try to change the patients or to be future patients, their bad habits, their behavior, and help them with their stress, all we see are just symptoms. So we both look at globally and locally. And we focus on prevention and health promotion. And the model is safe, effective, affordable, and accessible. And that's the problem. Because Chinese medicine is relatively inexpensive. And you do not generate a lot of money, and you would have no time and money to advertise. Whereas from a patient's perspective and from society perspective, Chinese medicine is very vital. Unfortunately, the dominant system right now is Western medicine, and they are able to generate so much money, and they are able to control the healthcare system much more than what Chinese medicine would be able to have impact. So our model really focuses on education of the patient. We teach them how to eat, how to sleep well, how to exercise appropriately, how to handle stress. We combine acupuncture and trigger point injection. We modify medications. We teach them how to do 8-4-K Qigong or Tai Chi or meditation or yoga. And we teach them different ways of stimulating the acupoints, which to me are ways for the body to tell us that you are not well. So we roll up our model for this person-centered medicine, but there's a difference between East and West, even with the same terminology. Western medicine just go by sitting down with a patient and telling them what choices they would make. Whereas Chinese medicine, the way we practice it is to try to allow us to look at the person, look at the whole person, its natural environment, its social environment, and try to do our very best to optimize it. I have written our model up in 2 papers with 2 visiting scholars, Professor Li Zhonglong from Beijing Hospital and Wu Xiaqiu from Hangzhou University of TCM. Well, this is a conference about COVID-19. And this is what I would like to talk about, what we have done the last 3 years. We continue to see patients because you are deemed essential by UCLA Health. We also take our work to the Chinatown Service Center to help that system of patients. Ironically, even they've been around for 50 years, the Chinatown Service Center did not have Chinese medicine in their healthcare system. We also have continued to train many of our medical students and residents, and also the community. So during the COVID-19, we get some funding to try to help educate different groups of patients and also people in the community. We also continue with our 4th-year course and our 1st-year course, and then we incorporate COVID-19 approaches. We also include this in helping safety net hospital healthcare professionals to learn about how to approach chronic pain to minimize the need for opiates. We actually did a safety study on Qingfei Paitutang, and that we also use a video to teach healthcare professionals how to do acupressure to minimize stress-related symptoms. And we were not allowed to see patients who are actively infected, but we see people who are affected by the anxiety leading to their chronic pain and the fatigue. We see a lot of the long COVID. We also see people who have wanted to prevent COVID-19 or other infections. We also localize some of the recommendations by China, because given Chinese medicine, particularly with herbal medicine, relies on affected by the by the patent. So we have many of the experts in Chinese medicine to try to review the recommendations from China, and based on their experience to try to include and put together a few manuals about treatment, and also trying to help with rehab. The secret for our success in building a program at UCLA is my focus on education. Ever since I started the clinic, I used the clinic to train our 1st-year med students, and then our 4th-year med students, and then our residents. And I created a fellowship in 1999, so that I go from a one-man band when I first started to now having 13 faculty members, 11 clinicians, and 4 fellows, and also visiting scholars. Clinical approach is important for us to demonstrate the value of Chinese medicine and showcase the person-centered model. And in terms of research, we have done different type of research, but most importantly, for us to have grown to where we are now, we obviously rely on our educational programs. And obviously I was a WHO advisor, and we also train not just people in healthcare, but also people in business and also people in the community. So this provides a list of some of the programs that we have done. We obviously rely on funding through our grateful patients with their foundations to allow us to build this program within UCLA. About 13, 14 years ago, we took our medical school course and make it available to university students who can be from different majors. I believe that everyone would benefit from learning about this model so that they can stay healthy. We also have been taking students to Shanghai to see how Chinese medicine and integrative medicine is practiced in both the cities and also in the rural areas. And we have been stopped by the pandemic since 2019. My interest is to really try to train young people, students, whether it's acupuncture or public health or business, not just medical students. And we are now developing a 4-year program to allow medical students at UCLA to get exposure to integrated medicine in our health system and our medical school. We also have been bringing our model to help train our teaching hospitals who care for marginalized patients. Many of them are poor, by teaching them ways to handle chronic pain, to minimize the addiction to opiates. So we begin an online curriculum, which we are going to be making available very soon outside of our teaching programs within UCLA or with our affiliated hospitals. We obviously try to take our work into the community. We want to go from ethnic Chinese to ethnic Hispanic, Afro-American, and for LA County with 10 million lives and so many cultures represented, we would like to optimize the person-centered model, whole person model, and make it culturally appropriate for different patient groups. In order to increase the number of Western physicians leading the transformation of their health system by incorporating traditional Chinese medicine, I collaborated with one of my former visiting scholars, Professor Zhao Jing, to take over 3 years, 60 plus Western trained physicians and healthcare leaders to go to China Academy of Chinese Medical Sciences, where they visit the Toyoyo's research base for herbal medicine, but also to visit many of the teaching hospitals in Beijing, and that they also learn a lot about, experience a lot about Chinese culture. We also work closely with local TCM universities to incorporate their education through a few conferences that we held, including one on Tai Chi. We cover scientific evidence all the way to program development in various healthcare settings. We also work closely with my colleagues in Shanghai. After I gave my keynote presentation in Shanghai 2011, I share a paper that I wrote in 2011. Actually, I shared this paper with Commissioner Wang Guoqiang when he visited us in 2010. And with this project, we helped train 10,000 Western trained physicians and public healthcare professionals to learn appropriate Chinese medicine in the entire Shanghai community health clinics. We also have been receiving many of the rising stars from various universities, from CACMS to Shanghai University of TCM and Hubei University of TCM. They spend 1 month, 3 months, besides the 1 year, 6 months visiting scholars who came to UCLA to see how we introduce Chinese medicine in a Western biomedical setting, and also to introduce them to the local TCM universities, colleges. And we also try to have them learn about some of the research approach that will be more suitable for Chinese medicine and integrated medicine. What we try to do is to be a bridge, given what we know about integrated medicine in the United States, which is very different from integrated medicine in China. And by virtue of all these educational programs, we try to improve communication among healthcare professionals who strive to improve healthcare through integrated medicine. And I believe that it's not just healthcare professionals that we need to train. Over the years, I have trained people who have both MD and MBA and JD, people in anthropology, sociology. I work with people in media, because I really believe that everyone needs to understand why there's a need for integrated medicine, and what is integrated medicine, what is integrative East-West medicine, in what way Chinese medicine should be better presented in modern language for the modern world understanding. Western biomedicine already have recognized the importance of the person and a societal holistic framework and the limits of reductionism. So I hope that not too much money is wasted in doing many of the research. It's probably best to do the big experiments of looking at how whole populations can improve using whole systems research. So this is what people in the West, the NCCIH, the National Center for Complementary Integrative Health, they now is pushing for the understanding of the importance of whole health. And so it's not just medicine. It involves not just a biological, but also looking at behavior and social and environmental aspect of it. And so these are all the components that we need to pay attention to. And the VA, the NIH, NCCIH, they all are now embracing the whole person health research. And this a type of research that I think people in China should embrace. To conclude my speech, I just want to kind of talk about my last 30 years of my journey. As I said before, I spent the first 20 some years to figure out what to do. And then the last 30 years starting talking about it and building the program of integrative medicine at UCLA, and through UCLA's platform, disseminated throughout the world. Most importantly, I think that the world needs this model of healthcare. And I already talked about back in 1997, 25 years ago, about the looming healthcare crisis. And I further talk about it in many subsequent WHO meetings. And I was invited as a advisor for how best to bring traditional complementary medicine into health systems and healthcare practices. I also participated in the Chinese Medicine Terminology Project by WHO. Crisis creates opportunity. I think that the healthcare crisis globally, aggravated by COVID-19, and in the United States, with obviously the racial injustice with healthcare disparities, and aging tsunami globally. And there is financial unsustainability. So the world is in need of a healthcare model. I believe that my last 50 years, I have learned enough to at least create something that hopefully will be helpful, but I don't want to be helpful as a last resort. I want to make it available for people early on. We want to educate all healthcare professionals, whether it's East or West, but also to help health advocates in every family to figure out how to navigate between East and West. 22 years ago, I wrote this paper for WHO about the importance of traditional Chinese medicine in clinical practice. And everything that I talk about is now just becoming much, much more urgent. I celebrated our 25th year with our colleagues in Shanghai first, and then Beijing, and then Wuhan, as a matter of fact, October, when we were last in Wuhan, 2019. So this is I hope that we will be able to help more people by disseminating the model, health model that allow people who can stay healthy and is affordable, accessible, because there's so many bankruptcies because of the high cost of the current biomedical treatments. I also hope that Chinese medicine, even though it's ancient, it has a lot of very advanced concepts that I would like more people to appreciate and benefit from it. And I hope that
because of the healthcare crisis, that everyone, all communities, countries work together to try to solve the healthcare crisis together. I was interviewed last year and by actually a group of very, very bright students. And it summarizes my last 50 years through this interview. It's both in English and in Chinese. With that, I'd like to thank you all for giving me this time to share my journey with you.